25, 30 minutes, I'm just going to share some of my own thoughts on the work we're doing in the authority and maybe where we're going into the future. So could I have the next slide, please? I suppose there's 5 different objectives I want to talk about here. Really, I just want to talk about the human in the context of work activity involving physical effort. I mean, we're now called the human factors in our ergonomic society, and that's important. And I think my presentation today will be more talking about the physical aspects of work. I want to talk again, and I think it's important always to have a little bit of background in terms of the legal aspects, because this is something we set out every time we carry out an inspection, looking at these areas, even at the very introduction of the agenda. We can highlight the legislation. I'm going to talk a little bit about some research that's relevant in terms of a management systems approach. And also, I like to talk about a prevention management program that we've developed around ergonomic risk management. Finally, I'll briefly touch on the Health and Safety Authority and its strategy around occupational health and ergonomics. Next slide, please. So the human in the context of work activity. So we have to recognize, and we as ergonomists accept that there are many variables that impact in terms of human performance at work and their interaction in the context of physical work activity. So if we look at the next slide here, we just see some examples. These are some examples of the scenarios that we come across as inspectors when we visit workplaces. On the left-hand side, if you just put up that slide, yeah, thanks. On the left-hand side there, you can see stone cladding being installed on a construction site. In that scenario there, the Health and Safety Authority were called upon. My inspector colleague contacted me about that, and we had to use enforcement action to stop that work. You think about that work activity and the impact it has on the individuals, and the impact it would have if they're doing that every day for a number of days, because they're involved in risk exposure to very high forces, awkward postures, static holding postures. The ambulance paramedic. This is a typical one again that we've come across. You know, the National Ambulance Service had a number of reportable incidents. The paramedics were engaged in taking off a defibrillator in a very awkward location. Then we have keg handling, which is a big challenge, and it's an area that certainly we're constantly looking at to improve in industry. And finally, then we have an example from the transport retail sector. It was a case study we did with a company down in Kilkenny where they were doing a repetitive handling of large loads. We asked the question, why? And we asked the question, have you assessed risk? So there's all these variables we need to think about. Next slide there, Diego, please. We need to think about the different variables. So first of all, the work environment. So what kind of work environment do we have? Is it cold? Is it noisy? What kind of space constraints are there? So if you look at these examples here, you know, there's a maintenance worker working he's kneeling down to carry out maintenance work. So you think of that machine when it came into the factory, there was no thought, consideration given to the fact that these people would have to carry out maintenance. So, you know, if you think about that at the design stage, really those issues should be kind of considered at that stage. In the middle example, there's a welding operation going on, and the workers in that scenario again are engaged in very awkward posture, carrying out welding. And the impact of that is not only from their point of view because of fatigue and potential injury, the fact that they're going to have fatigue over a period of time means that the quality of their work will suffer. And we've seen studies like that. Volvo in Sweden did a number of studies on that, which looked at the relationship between poor ergonomics and poor quality output. So these are things in the environment that have a big impact. If we look at the next slide then, please, Diego, we then need to consider, you know, the key variables such as the type of work, the work environment, materials and equipment used, and the individuals involved. So all stakeholders are involved in those decisions, and it's important that all stakeholders are involved in ensuring there's a positive change. Next slide, please. So let's just look at the example in a bit more detail that I showed you. Stone cladding was being carried out on the construction site. The issue is very high risk exposure to physical ergonomic risks. There was no evidence of any risk assessment. There was no evidence that the issue had been addressed at the design stage in the project. We came on site. Our intervention was that the work was stopped. We engaged with the project team, and we asked them to address these very high risk exposures. Who do we talk to? We talked to the project supervisor, construction, the design process, PSTP, subcontractors, scaffolders, the engineers who certified the lifting equipment, and the stone cladding suppliers. So you can see there, just one simple task, how many different stakeholders are involved and all the variables that they bring to the table. Next slide, please, Diego. Thank you. So as a result of the engagement with all these different stakeholders, next slide, please. We finally got a solution. Now, this solution you see in this photograph, this was a solution that was put in place after about 5 days, after they had been shut down for 5 days, and this is the solution they came up with. So our question was, we were very happy to see this solution, but our question was, why wasn't consideration given at the very, very early stage of the project, the design stage of the project, to consider the human in the overall project and what they would have to do? So again, it's just underlining the importance of human consultation, thinking outside the box, educating designers around the importance of ergonomics and ergonomic assessment at a very early stage. Next slide, please, Diego. So just on the legal context now, I mean, our legislation, we have a number of pieces of legislation. We have the DSE regs, which looks at office ergonomics, remote working. We have the manual handling of loads regulation. We have the Safety, Health and Welfare at Work Act and the Principles of Prevention, which talk about adapting work to the individual. But when you look at those pieces of legislation, it talks about prevention of risk to health, evaluating unavoidable risks. Next slide, yeah, so that one. So I suppose what I'm getting across here is we realized that if we were really going to address ergonomics in the workplace, from our perspective as regulators, we needed to kind of talk about ergonomics as a management system and ergonomic risk management. And if you look at the definition of management, it talks about a management system is the way in which the organization manages interrelated parts of a business in order to achieve its objectives. So in the legal context, ergonomic risk needs to be managed and all the variables, interrelated variables, including the type of work, the work environment, the stakeholders, need to be managed in order to work towards the prevention and management of musculoskeletal injury and ill health. So with that in mind, next slide, please, Diego. With that in mind, then we looked at you know, what the research was saying, and interestingly enough, actually, you know, we had developed a guidance on prevention and management of musculoskeletal disorders with kind of a management approach a number of years ago. But then back in 2021, EU OSHA published a very interesting report, Work-Related Musculoskeletal Disorders, Prevalence, Costs and Demographics in the European Union. And some of the key recommendations that they had were that there needed to be systematic planning and implementation of policy initiatives to ensure the formal impact evaluation of any interventions. The focus needed to be on risk assessment. It should be changed to focus on risk assessment and prevention activities at the workplace, sharing good practice examples. The range of prevention activities should be broadened to focus on work design and ergonomics as a means of removing risk at source, taking a systems approach to prevention and job design. So in a way, we were happy to hear that these were recommendations, because this is something that we've been advocating for a long time, that we need to look at ergonomics in a management system approach as opposed to just a unique aspect of a risk assessment. It also recommended workers needed to be involved in risk assessment and prevention activities. And this is key. It comes across, it's something I come across all the time. Even yesterday I was on an inspection, and it's something that we were asking about very clearly in terms of you know, this particular workplace. They were doing a big project, a big construction project extension. So the kind of questions we asked on the inspection were the users, the people that were going to be working in that area, have they been involved in the design? Have they been able to give input in terms of the layouts of work areas? And happily in this situation, yes, they are. There's a design review that looks at ergonomics in that scenario. So again, I have to believe that these recommendations are still very relevant, still very important, and we still have work to do in regard to this. We haven't got these issues addressed completely. Next slide, please. Yeah. So if we look at the key policies then that we have in our managing ergonomic risk to improve musculoskeletal health, we have in there, we've spoken about, and this guidance is available on our website, hsa.ie. We talked in there about 6 elements. First of all, the importance of having a policy. And I can't underline this enough. I go into workplaces and, they do a lot of manual handling work activities in some scenarios. And in scenarios like that, I would expect that in the safety statement that there's a manual handling risk policy. Like the healthcare sector are very, very proactive in developing manual handling and patient handling policies. But that needs to expand to other sectors as well, particularly in sectors or industries or workplaces where there are ergonomic issues. And this policy needs to be very clear, and there needs to be a statement of intent. So if you think about the manual handling of load regulation, there should be a policy in there about, outlining the key work activities in a workplace, acknowledging that, manual handling may be a potential risk, acknowledging that there's legislation that governs the manual handling of loads in the workplace, acknowledging and outlining what's going to be done proactively by management to assess and address those risks so that workers are not impacted and their performance is not impacted because they have neglected to address ergonomic risk. So that's the first element. The second element then is, it goes without saying, the importance of risk assessment. And risk assessment, even before risk assessment, there's a need to look at an overarching view of an organization, look at the flow process, look at the human interaction at each stage of the process. Carry out, even go to go through consultation and maybe through training of staff, in risk assessment techniques, maybe ahead of doing any risk assessment, do an audit and get some training on use of risk assessment tools, and then go around the workplace and robustly and objectively identify what tasks need to be assessed. And then from there, you carry out your risk assessment approach using, evidence-based risk assessment tools. We don't hide the fact that we advocate the use of MAC, RAP, and ART as part of our simple 5-step methodology for risk assessment. If you're going to use any kind of risk assessment tool, you need to be able to support your results in a very effective way, because the risk assessment tool has to give you the results you need. It needs to be effective in recognizing and quantifying risk. And then the importance of training. Now, training, when I joined the authority 25 years ago, we had this kind of culture of lifting the box close to the load. And that was it. That was training. That was ergonomics from my initial perception when I joined the Health and Safety Authority. So there had to be a big exercise done to, and everybody's been involved in this over the many years to, increase the knowledge and understanding around ergonomics and manual handling risk through risk assessment methodologies, through policy. And then we look at, accident and near-miss reporting and investigation. Again, we've done research in the past in the healthcare sector where we were looking at accidents and near misses, and we found that there was, breakdowns in some scenarios where the reports were not, there wasn't immediate reporting of incidents, and then in some cases there may not be any follow through. And this is something we come across, a lot. An accident investigation, particularly for reportable incidents, we would expect that there would be a comprehensive investigation carried out for a reportable incident. So when we look at those during inspection, we kind of, I suppose, interrogate the investigation to see, has it been effective in identifying root causes? Has it been effective in identifying suitable corrective actions? And are those corrective actions effective in addressing and ensuring that those injuries won't happen again? So sometimes, even from the point of view of a reportable incident, particularly relating to manual handling, it's a good idea to do a follow-up risk assessment to see, are the risk exposures addressed, which result in an injury. Another element that we included in this guide was around injury management and rehabilitation, return to work. Now, notwithstanding that, I suppose the whole area of return to work injury management, it's not within the remit of the Health and Safety Authority. But we do look at, where scenarios exist, where an individual has has a particular disability or something that makes it more difficult for them to work in the workplace, it's important that reasonable accommodations are considered and taken into account as part of the risk assessment methodologies. That would be a key point we would make. Finally, we talk about internal auditing. I talked about earlier about the audit of the workplace to identify manual handling tasks, but it's also a good idea to do, random internal audits to look at workplace setups, look at where there may be scope for where there may be gaps and maybe scope for further continuous improvement in how work is carried out. Next slide, please, Diego. So the last thing I really just want to talk about is, I suppose you can go through those slides, Diego. I've really spoken to those. The first that was around the policy. If you want to just run through those, you can keep going there. Yeah, risk assessment, macro and art. So you can keep going through those slides. So they're just the supporting notes for what I was talking about there. If you just want to go on to after step 5, element 5, please. There you go. Thanks. So all that information in the slides, I think it will be made available, Cara. This information will be available, yeah. Okay, so if we just go on to the next slide then, please. The last thing I just want to talk about is I spoke about internal auditing, and again, the importance of that feedback loop, that if you do internal audits, that you feedback and any corrective actions are addressed, and there's some way of tracking that. A lot of companies now, they have near miss reporting, and they have a system for tracking all kinds of incidents, whether it's an actual injury or whether it's a near miss or where it's something that comes out of an audit, and those are their key performance indicators that can be managed and addressed. Next slide, please. Okay, so the last thing I just want to talk about here today is the Health and Safety Authority and its strategies. We have a strategy that we develop every 3 years, the Health and Safety Authority. And back in 2014, I think, was the first time that the Health and Safety Authority included strategies around workplace health. Before that, it would be typically safety strategies. So we were involved in giving a lot of input to that strategy back in 2014. And at that time, the key strategy objectives around health were increased knowledge and understanding of OC health, increased knowledge and understanding of the importance of assessing health risks, and third point was proportionate enforcement. So building on that strategy over a number of years, the most recent strategy of the Health and Safety Authority, which was just recently published, which is for 2025 to 2027, talks about the need to build and support compliance as priority number 1. And what we mean by that is, developing particular inspection programs that look at ergonomic and health issues in the construction sector and health sector. So over the last 3 or 4 years, we've been carrying out a range of inspections across all healthcare hospitals in Ireland, with both HSE, voluntary hospitals and the private hospitals. And what we're looking at there is we're looking at ergonomics, risk management, not just patient handling. We're looking at inanimate manual handling. So we're going into areas like records management, pharmacy, stores, laundry, catering, the whole spectrum, and maintenance. We're looking at all those areas, and we're kind of probing how are the ergonomic risks being managed in those areas. In the construction sector, we're looking at particular projects to look at focus on specific types of load installation, like what we spoke about earlier: cladding, glazing, fire doors, all these kind of different types of activities to go on in construction that potentially lead to risk. And we're looking at those work activities both from the point of view of the actual installation on site, but also maybe talking with contractors who are doing that type of work, and maybe creating an education piece around that to educate them around what we expect from a manual handling risk assessment point of view. The other priority we have is a key one as well, is apart from just inspection, we have a very important role in education, influencing and collaborating. And my colleague Joan, who's online today, she's very involved. We work closely with Joan, and we have for a number of years. And we worked on developing an e-learning course back in 2023, which was published in 2023, called Introduction to Ergonomic Risk Assessment. And that e-learning module is really just explaining our 5-step methodology for risk assessment and explaining the use of the MAC Rapid Art tools. It's a useful piece of training. It's recognised by Engineers Ireland. It's a useful thing for introducing ergonomics to workers in a workplace that may be involved in risk assessment. It's something that maybe would be useful to share with safety representatives as well. And again, all this information is available on the HSA website for free to download. We also have done a lot of work on BSmart around ergonomics, and we're currently doing a review of our ergonomics information on BSmart to refine it and make it more effective. And then we have developed new sector-specific guides for different sectors. In fact, we've just published a new guide for the health sector on health and safety management in the health sector. And then again, a big part of the strategy as well is to ensure that our inspectors, because we have inspectors that go, they're very focused on specific sectors. So it's our role in the health division to make sure that they have the tools available to allow them to make judgments on whether or not ergonomic issues are being assessed or addressed in the workplace. So we provide a comprehensive training to our inspectors on ergonomic risk assessment tools. And that allows them then to recognize, by knowing and understanding what an ergonomic risk is, whether it's repetition, awkward posture, excessive force. If they come across that situation, they have a few tips that we give them in terms of what they should do. Well, first of all, they should flag the issue with the employer. They should take some photos. They should get documentation of the risk assessment that's available, and then they should address that on site or else refer it to the Health Ergonomics group. So this training is continuing, and we have about 20 new inspectors just joined the authority this year. And over the course of the next few months, they'll be getting that training. So that means then we have a team. It's not just myself and my 2 colleagues in the ergonomics group, but also we have a team of inspectors out there looking at these issues and reporting back to us. If they cannot address it themselves, they report back to us, and then we follow through with them on a referral process, inspection process. So I suppose if you just want to go to the next slide, then there you go. I think really, that's really as much as I want to kind of share with you today. We've talked about the importance of the human in the context of work activity, the importance of the legal aspects and keeping that in mind at all times, the importance of relevant research. And interestingly enough, I was at a workshop recently in the University of Galway, which looked at the use of exoskeletons, a research project looking at the use of exoskeletons in the healthcare sector. And again, all these new developments in AI, exoskeletons, robotics, that's going to have a huge impact on work. And certainly there'll have to be, a look at how that's going to be regulated in a workplace setting. And these are things that we have to be conscious of and keep in mind into the future. I can't underestimate and I can't, highlight enough the importance of addressing ergonomics through a systems approach. And finally, I just spoke briefly about the strategies, the Health and Safety Authority strategies, and the importance of the need to evolve and take account of the future workplace and the implications for workers in any new regulation, any new guidance, and any new inspection approaches that we do into the future. That's it, really, Diego. I think that's it. Next slide. I think that's pretty much it. Yeah, thank you very much, everybody.